I started smoking when I was 14 years old. I had my first cigarette.
Just roll your shoulders forward and your arms out.
Smoked for 30 years.
All right, breathe in, hold it. All right, you can relax and let it out now.
Watched my father-in-law die from emphysema, so that was the deciding factor for me. I had to do something about it then. Feeling better than I did the last time I saw you.
That's good, that's great.
What Kathleen Fisher did was quit smoking. That was 15 years ago. But this past summer she learned that her smoking past hadn't exactly faded into history.
This area of the lung was where the tumor is, and we removed the lung, which would have been in this area here.
She was diagnosed with lung cancer. In spite of that, Mayo Clinic surgeon Dr. Stephen Cassavy says Kathleen is extremely lucky. It was detected so early as a stage 1 tumor that minimally invasive surgery seems to have delivered a cure with no need for additional treatment like chemotherapy or radiation.
But her case is very illustrative of the opportunities that can be found in lung cancer screening.
Multiple studies, including the National Lung Screening Trial, which Mayo Clinic participated in, showed that looking inside the body with CT scans can reduce lung cancer deaths by 20% in high-risk groups of people.
Using the low-dose CT screening program system, we need to treat about 300 or so patients to save a life.
With 87% of lung cancers attributed to smoking, heavy smokers, those who've smoked the equivalent of a pack of cigarettes a day for 30 years or more, are at the highest risk. Adding to the problem, lung cancer often presents no symptoms until it's very advanced.
I think you just always assume that because you feel good, you're okay.
Kathleen's husband Gary was also a heavy smoker, so together they volunteered for a medical study in their home state at the University of Iowa Hospitals and Clinics. The COPD gene study's goal is to identify genetic links that predispose people to develop lung diseases such as emphysema. It uses low-dose CT scans to reveal changes in lung capacity as well as muscle and bone structure.
So the CAT scan is providing us a very rich database to really correlate the genes and these characteristics.
Pulmonologist and researcher Dr. Alejandro Comelas says the scans also tipped Kathleen off to the tiny cancerous tumor growing in her lung.
We did 1 scan a year, and the 3rd year it looked a little suspicious.
We know with lung cancer, as with many other cancers, but specifically with lung cancer, that your survival from treatment of it is directly related to the stage at which it is first found.
I mean, I think I'm living proof.